Hepatitis, an inflammation of the liver, can progress to liver failure, cirrhosis, and even cancer. Hepatitis C is the viral infection that causes the liver swelling. Hepatitis C is spread through contact with infected blood, and a person can become infected through sharing needles or syringes, or from unsafe medical procedures, such as blood transfusions with unscreened blood products. At the launch of the guidelines and the laboratory strategy Wednesday, Dr. Ijaz Hatim, the Chief Resident of Internal Medicine at the Georgetown Public Hospital Corporation, who helped develop the guidelines, noted the advances Guyana has made in treating the infection.
Generally, as someone who treats patients with chronic diseases such as diabetes, hypertension, and chronic hepatitis C, the first conversation with these patients is extremely critical, especially when they are newly diagnosed. It is essential to help them to understand the nature of the disease that they have, and sometimes with the fact that they may have to live with this disease for the rest of their life. And in that conversation, patients usually ask two questions sometimes. They will ask, how long do they need to use tablets for? And doctor, is there a cure? And in terms of that, recently, as recent as maybe 3 to 4 years ago, patients diagnosed with hepatitis C faced a similar conversation, especially with the disheartening news that there was no treatment modality available in Guyana to attend to these patients. We had to inform them that regular surveillance, lifestyle changes was the only thing that we could have done to monitor the disease's progression to either end-stage liver disease or to slow it down from getting there, and possibly hepatocellular cancer. However, today, and through collaboration with our Ministry of Health and PAHO, that conversation can now take a drastic different turn. We can now enlighten these patients about the availability of a cure. A 12 or 24-week regimen of a very tolerable medication now has the potential to not only cure, but as we say in medical jargon, achieve a sustained virological response in patients affected by hepatitis C. This not only brings a beacon of hope, but allows patients affected with these conditions to look forward to a normal, healthy life.
Minister of Health Dr. Frank Anthony stressed the importance of having a standard when it comes to the operations of laboratories and dealing with hepatitis.
We have our National Public Health Reference Laboratory, and we have laboratories at each of our regional hospitals, and then further down the chain we have different types of laboratory, or we do different types of laboratory work. And so we felt that it's important that we kind of standardize what we are doing at different levels. And sometimes if we don't standardize, different regions will want to broaden what they can do and do a lot more and ask for a lot more things, and it can become very complicated, because when you have 5 and 6 different types of machine that can do the same thing, when you have to buy different types of reagents, it can become very cumbersome. So that's something that we want to have some standards, and I think this strategy captures some of those standards that we're looking for at different levels. But also it's a forward-looking document, because there are things that we would like to do with our labs that we are not able to do right now. And so in looking to the future, we want to make sure that we start building capacity to be able to do some of these things. So one area that we feel that is going to be very important going forward in the future is that we must have capabilities of doing gene sequencing. They have started at the lab through one of the projects that we've had in collaboration with Harvard University. And so they have some experience now in doing this, but what we are doing now is using what we have learned for malaria and putting it into use for some of the other diseases. And there are some other areas that we want to build out, but ultimately we see ourselves in the next coming set of years to be able to be one of the reference centers in the Caribbean. And so whether it's in infectious diseases or in other areas, that's how we see ourselves.
The launch of the guidelines was done by the Ministry of Health in collaboration with the Pan American Health Organization and the World Health Organization, PAHO/WHO.
Currently, globally, only 30% of people who are living with active hepatitis C know their status. Less than 20% of them are getting treatment. So here in Guyana, you have an opportunity to really make a huge public health difference with the work you're going to do.
The Hepatitis Guideline and Laboratory Strategy is amongst the first to be launched in the Caribbean region. The clinic in Guyana is the first in the Caribbean. Reporting for the newsroom, I am Brad D'Souza.